Think intimacy after 60 is a thing of the past. Think again. What if I told you that the best is yet to come, and it's closer than you think? From surprising health perks to simple ways to reignite the spark, this video is your no-holds-barred guide to thriving in the bedroom and beyond after 60. Get ready to uncover the secrets your doctor won't tell you, because it's time to embrace this exciting, often overlooked part of aging. Let's dive in. Sexual health is a vital part of overall well-being, no matter your age. It's not just about physical pleasure, it's about connection, intimacy, and feeling alive. But for seniors, this topic often gets brushed under the rug. Whether it's due to societal stereotypes, personal discomfort, or a lack of information, many people over 60 assume that their intimate lives are over. But here's the truth. Intimacy after 60 isn't just possible, it can be more fulfilling than ever. That said, there are unique challenges that come with aging. Changes in hormones, health conditions, medications, and even self-confidence can all play a role. But with these challenges come incredible opportunities to rediscover intimacy in new and meaningful ways. In this video, we are breaking down everything you need to know about sexual health after 60. From debunking myths to exploring the surprising benefits of staying intimate, we'll cover it all. Whether you're in a long-term relationship, exploring new connections, or simply curious about how to feel your best, this is the conversation you've been waiting for. Let's dive in and rewrite the narrative on aging and intimacy. Let's take a deep dive into the myths and misconceptions surrounding senior sex, because these outdated ideas have been holding people back for far too long. By the end of this section, you'll see that intimacy after 60 isn't just possible, it can be one of the most fulfilling and joyful parts of life. First, let's tackle the biggest myth of all, the idea that seniors lose interest in sex as they age. This couldn't be further from the truth. While it's true that libido can change due to hormonal shifts, health conditions, or medications, the desire for intimacy and connection often remains strong, and for many, it even deepens with time. In fact, studies show that emotional intimacy becomes more important as we age, and many seniors report that their sex lives improve because they feel more comfortable, confident, and connected to their partners. Another common misconception is that sex after 60 is unsafe or unnecessary. Some people believe that seniors should slow down or retire from their intimate lives, but this couldn't be more wrong. Intimacy is a vital part of overall well-being, offering physical, emotional, and even cognitive benefits. From reducing stress and improving heart health to boosting mood and strengthening relationships, sex plays a key role in maintaining a vibrant, healthy life. And when approached with care and communication, it's just as safe as it was in your younger years. Then there's the myth that physical changes, like menopause, erectile dysfunction, or arthritis, mean the end of a satisfying sex life. While these changes can present challenges, they don't have to be deal breakers. With the right mindset, tools, and sometimes a little help from healthcare professionals, you can adapt and find new ways to enjoy intimacy. For example, lubricants can make sex more comfortable for women experiencing vaginal dryness, while medications or devices can help men with erectile dysfunction. And let's not forget the power of creativity. Exploring new forms of intimacy, like massage, cuddling, or even sensual touch, can be just as fulfilling as traditional sex. Another myth that needs to be debunked is the idea that seniors are too old for romance or new relationships. Society often portrays aging as a time to slow down and step back, but the truth is, love and connection have no expiration date. Whether you're in a decades-long partnership or starting fresh after a loss or divorce, intimacy can be a source of joy, comfort, and vitality at any age. In fact, many seniors find that dating later in life is more enjoyable because they know themselves better, have clearer priorities, and are less concerned with societal expectations. And let's not forget the myth that seniors should feel embarrassed or ashamed about their sexual desires. This stigma is one of the biggest barriers to a fulfilling, intimate life after 60. The truth is there's absolutely nothing to be ashamed of. Sex is a natural, healthy part of life, and wanting to feel close, connected, and desired is completely normal, no matter your age. Finally, there's the misconception that sex after 60 is just not the same. While it's true that intimacy may look different as we age, that doesn't mean it's any less meaningful. In fact, many seniors find that their intimate lives become richer and more satisfying because they're less focused on performance and more focused on connection. It's about quality, not quantity, and that's something to celebrate. So let's leave these myths behind and embrace the truth. Sex after 60 isn't just possible, it can be better than ever. It's about understanding your body, communicating openly with your partner, and being willing to explore new possibilities. As we age, our bodies naturally go through changes, and that includes our sexual health. For many seniors, these changes can feel daunting, but here's the good news. They don't have to mean the end of a fulfilling, intimate life. In fact, with the right knowledge and tools, you can adapt and continue to enjoy intimacy in ways that are comfortable, satisfying, and even exciting. Let's take a deep dive into the physical changes you might experience and the practical solutions that can help you navigate them. First, let's talk about men. One of the most common issues men face as they age is erectile dysfunction, ED. This condition, which makes it difficult to achieve or maintain an erection, affects about 40% of men by age 40, and that number increases with age. While ED can be frustrating, it's important to know that it's not a reflection of your masculinity or desirability. It's simply a medical condition, and there are many ways to address it. Medications like Viagra, Cialis, and Levitra are often the first line of treatment for ED. These drugs work by increasing blood flow to the penis, making it easier to achieve an erection. However, they're not the only option. For men who can't take these medications or prefer not to, there are other treatments available, such as vacuum erection devices, penile injections, or even surgical implants. Lifestyle changes, like quitting smoking, losing weight, and managing stress, can also improve erectile function. And let's not forget the importance of communication with your partner. Talking openly about ED can reduce anxiety and help you both find new ways to connect. Now, let's turn to women. One of the most significant changes women experience as they age is menopause, which can lead to vaginal dryness, thinning of the vaginal walls, and a decrease in libido. These changes are caused by a drop in estrogen levels, and they can make sex uncomfortable or even painful. But just like with ED, there are solutions. Vaginal moisturizers and lubricants can make a world of difference. Moisturizers are used regularly to keep vaginal tissues hydrated, while lubricants are applied before sex to reduce friction and discomfort. There are also prescription treatments like estrogen creams, tablets, or rings, which can help restore vaginal health and improve comfort during sex. For women who prefer non-hormonal options, treatments like laser therapy or platelet-rich plasma, PRP, injections are becoming increasingly popular. But physical changes aren't the only factor to consider. As we age, our bodies may also become less flexible, and conditions like arthritis or chronic pain can make certain positions or activities uncomfortable. The key here is creativity and adaptability. Experiment with different positions that are more comfortable for you, or explore non-penetrative forms of intimacy like massage, kissing, or cuddling. The goal is to focus on connection and pleasure, rather than sticking to a specific script. Another important aspect of adapting to physical changes is maintaining overall health. Regular exercise, a balanced diet, and staying hydrated can all improve your energy levels, circulation, and sexual function. Pelvic floor exercises like Kegels are particularly beneficial for both men and women. For men, they can improve erectile function and control, while for women, they can strengthen the muscles that support bladder control and sexual satisfaction. And let's not forget the role of mental and emotional health. Stress, anxiety, and depression can all impact your libido and sexual performance. If you're struggling with these issues, don't hesitate to seek help from a therapist or counselor. Talking openly about your feelings, whether with a professional or your partner, can make a big difference in your intimate life. Finally, it's important to remember that intimacy is about more than just physical pleasure. It's about connection, trust, and feeling close to someone you care about. As you navigate these changes, focus on the emotional aspects of intimacy as much as the physical ones. Hold hands, share a laugh, or simply spend time together doing something you both enjoy. These moments of connection can be just as meaningful, and sometimes even more so, than traditional sex. So, while physical changes are a natural part of aging, they don't have to define your intimate life. With the right tools, mindset, and support, you can adapt and continue to enjoy a fulfilling, satisfying sex life well into your golden years. Sex isn't just a physical act, it's deeply emotional and psychological. For seniors, this aspect of intimacy becomes even more important as we navigate the unique challenges that come with aging. From loss of confidence to grief, relationship changes, and even societal stigma, there are many emotional and psychological factors that can impact your intimate life. But here's the good news. With the right mindset, tools, and support, you can overcome these challenges and create a fulfilling, joyful, intimate life. Let's dive into the emotional and psychological factors that matter most and how you can address them. First, let's talk about confidence. As we age, it's common to feel less confident about our bodies. Maybe you've noticed changes in your appearance, or perhaps you're self-conscious about physical limitations or health conditions. These feelings are completely normal, but they don't have to hold you back. Confidence is a mindset, and it starts with self-acceptance. Take time to appreciate your body for all it's done for you over the years. Focus on the things you love about yourself, your wisdom, your sense of humor, your resilience. Surround yourself with positivity, whether it's through affirmations, supportive friends, or activities that make you feel good. And remember, confidence is contagious. When you feel good about yourself, it radiates to those around you, including your partner. Another emotional factor that can impact intimacy is grief. Whether you've lost a spouse, a partner, or a close friend, grief can leave you feeling disconnected and unsure about how to move forward. It's important to give yourself time to heal and process your emotions. There's no right timeline for grief, and it's okay to take things one day at a time. If you're ready to explore new connections, take it slow and be kind to yourself. And if you're in a relationship, don't be afraid to lean on your partner for support. Grief can bring people closer together, and sharing your feelings can deepen your emotional connection. Relationship changes are another common challenge for seniors. Whether you're in a long-term partnership or starting a new relationship, it's normal for dynamics to shift over time. Maybe you've been together for decades and are navigating changes in your roles or routines. Or perhaps you're dating again after a loss or divorce and figuring out how to build a new connection. The key here is open communication. Talk to your partner about your feelings, desires, and concerns. Be honest about what you need and listen to their needs as well. Remember, intimacy is a shared experience, and it's important that both partners feel heard and valued. Societal stigma is another emotional barrier that many seniors face. Society often portrays aging as a time to slow down or retire from intimacy, but this couldn't be further from the truth. The truth is, intimacy is a natural, healthy part of life at any age, and there's absolutely nothing to be ashamed of. If you've internalized these negative messages, it's time to let them go. Surround yourself with people who celebrate you for who you are, and don't be afraid to challenge stereotypes. You deserve to feel confident, desired, and fulfilled, no matter your age. Stress and anxiety are also common emotional factors that can impact intimacy. Whether it's financial worries, health concerns, or the pressures of caregiving, stress can take a toll on your libido and overall well-being. The key is to find healthy ways to manage stress. Exercise, meditation, and deep breathing techniques can all help reduce anxiety and improve your mood. And don't underestimate the power of laughter. Spending time with loved ones, watching a funny movie, or simply sharing a joke with your partner can lighten the mood and bring you closer together. If you're struggling with emotional or psychological challenges, don't hesitate to seek help from a therapist or counselor. Therapy can provide a safe, non-judgmental space to explore your feelings and develop strategies for overcoming obstacles. Whether you're dealing with grief, relationship issues, or simply feeling stuck, a therapist can help you gain clarity and confidence. And if you're in a relationship, couples therapy can be a powerful tool for improving communication and strengthening your bond. Finally, let's talk about the importance of emotional intimacy. While physical intimacy is important, emotional connection is the foundation of a fulfilling relationship. Take time to nurture your emotional bond with your partner. Share your thoughts, dreams, and fears. Show appreciation for the little things they do and make an effort to create moments of connection throughout the day. Whether it's a heartfelt conversation, a shared hobby, or simply holding hands, these moments of closeness can deepen your relationship and make physical intimacy even more meaningful. So, while emotional and psychological factors can present challenges, they also offer opportunities for growth and connection. By addressing these factors head-on, whether through self-acceptance, open communication, or professional support, you can create a vibrant, fulfilling, intimate life that brings joy and meaning to your golden years. Here's the best part. Staying sexually active after 60 isn't just enjoyable, it's incredibly good for your health. In fact, research shows that maintaining an active, intimate life can have a profound impact on your physical, emotional, and even cognitive well-being. From boosting your mood to strengthening your immune system and improving heart health, the benefits of senior sex are too good to ignore. Let's dive into the science-backed reasons why staying intimate can help you live your best life, and why it's about so much more than just pleasure. First, let's talk about the physical benefits. One of the most well-documented benefits of sex is its impact on heart health. Sexual activity is a form of exercise, and like any physical activity, it gets your heart pumping and improves circulation. Studies have shown that regular sexual activity can lower blood pressure, reduce the risk of heart disease, and even improve cardiovascular function. In fact, one study found that men who had sex at least twice a week were 45% less likely to develop heart disease than those who had sex less frequently. For women, sexual activity has been linked to improved vascular health and a reduced risk of stroke. But the benefits don't stop there. Sex is also a natural mood booster. During sexual activity, your brain releases a flood of feel-good chemicals, including endorphins, oxytocin, and dopamine. These chemicals not only make you feel happy and relaxed, but also help reduce stress and anxiety. Oxytocin, often called the love hormone, plays a key role in bonding and emotional connection, making you feel closer to your partner. And let's not forget about the power of touch. Physical affection, whether it's holding hands, hugging, or cuddling, can lower cortisol levels, the stress hormone, and promote a sense of calm and well-being. Another surprising benefit of senior sex is its impact on the immune system. Research has shown that regular sexual activity can increase the production of immunoglobulin A, IgA, an antibody that plays a crucial role in fighting off infections. In other words, staying intimate can help keep your immune system strong and reduce your risk of getting sick. Sex also has cognitive benefits. Studies suggest that sexual activity can improve brain function and even reduce the risk of cognitive decline. One study found that older adults who remained sexually active performed better on cognitive tests than those who were not. This may be due to the combination of physical activity, emotional connection, and stress reduction that sex provides. For women, sexual activity can have specific benefits related to menopause and beyond. Regular sex can help maintain vaginal elasticity and lubrication, reducing the risk of discomfort or pain during intercourse. It can also help balance hormone levels and improve overall pelvic health. For men, sexual activity has been linked to a reduced risk of prostate cancer. One study found that men who ejaculated more frequently had a lower risk of developing prostate cancer, suggesting that regular sexual activity may have protective effects. But the benefits of senior sex aren't just physical, they're emotional and relational too. Intimacy fosters a deep sense of connection and trust between partners, which can strengthen your relationship and improve overall satisfaction. For couples who have been together for decades, maintaining an active sex life can reignite the spark and keep the relationship vibrant. And for those who are single or starting new relationships, intimacy can provide a sense of joy, excitement, and fulfillment. Sex can also boost your self-esteem and confidence. Feeling desired and connected to your partner can remind you of your worth and help you feel more comfortable in your own skin. This is especially important as we age, when societal messages about beauty and desirability can sometimes make us feel invisible. And let's not forget about the simple joy of pleasure. Sex is one of life's greatest pleasures, and there's no age limit on enjoying it. Whether it's the thrill of a new connection or the comfort of a long-term partnership, intimacy can bring joy, laughter, and a sense of aliveness that enriches every aspect of life. So, while the physical benefits of senior sex are impressive, the emotional and relational benefits are just as important. Staying intimate after 60 isn't just about living longer, it's about living better. It's about feeling connected, confident, and fully alive, ready to take charge of your sexual health and enjoy a vibrant, fulfilling, intimate life after 60. Here are some practical, actionable tips to help you stay connected, confident, and healthy. First and foremost, staying active and maintaining a healthy lifestyle is key. Regular exercise, such as walking, swimming, or yoga, can improve your energy levels, flexibility, and circulation, all of which are essential for a satisfying sex life. Exercise also boosts your mood and reduces stress, making it easier to relax and enjoy intimacy. Pair this with a balanced diet rich in fruits, vegetables, lean proteins, and whole grains to support overall health and vitality. Staying hydrated is equally important, as dehydration can lead to fatigue and discomfort. Communication is another cornerstone of a healthy sex life. Whether you're in a long-term relationship or exploring new connections, open and honest communication with your partner is essential. Talk about your desires, boundaries, and any concerns you may have. If physical changes like menopause or erectile dysfunction are affecting your intimacy, don't shy away from discussing them. Remember, intimacy is a shared experience, and working together to find solutions can strengthen your bond. If you're single, don't be afraid to communicate your needs and expectations with potential partners. Don't hesitate to seek medical advice if you're facing challenges. Many seniors avoid talking to their doctors about sexual health, but this is a missed opportunity. Your healthcare provider can offer valuable guidance, whether it's recommending treatments for erectile dysfunction, prescribing hormone therapy for menopause symptoms, or suggesting lifestyle changes to improve your overall health. They can also help you navigate any medications that might be affecting your libido or sexual function. If you're uncomfortable discussing these topics with your regular doctor, consider seeking out a specialist, such as a urologist or gynecologist, who has experience in senior sexual health. Exploring new ways to connect intimately can also breathe new life into your sex life. Intimacy isn't just about intercourse, it's about connection, touch, and shared experiences. Try experimenting with different forms of physical affection, like massage, cuddling, or sensual touch. If physical limitations are a concern, focus on activities that feel comfortable and enjoyable for both partners. For example, side-by-side positions or using pillows for support can make intimacy more comfortable. And don't underestimate the power of non-physical intimacy, like sharing a meaningful conversation, laughing together, or simply spending quality time as a couple. Finally, prioritize your mental and emotional well-being. Stress, anxiety, and depression can all take a toll on your libido and overall satisfaction. Practice stress management techniques like meditation, deep breathing, or journaling to help you feel more relaxed and present. If you're struggling with emotional challenges, consider seeking support from a therapist or counselor. Therapy can provide a safe space to explore your feelings, build confidence, and develop strategies for overcoming obstacles. By following these tips, you can create a healthy, fulfilling sex life that brings joy and connection to your golden years. Remember, intimacy is a journey, not a destination, and it's never too late to embrace this beautiful part of life. Your sex life doesn't have an expiration date. If you've been avoiding this topic, it's time to start the conversation with your partner, your doctor, or even yourself. Intimacy is a vital part of living a full, vibrant life, and it's never too late to embrace it. Whether you're rekindling the spark in a long-term relationship, exploring new connections, or simply learning to love and appreciate your body, the journey starts with a single step. So, what's your next step? Maybe it's having an open conversation with your partner about your desires and needs. Perhaps it's scheduling a checkup with your doctor to discuss any concerns or explore treatment options. Or maybe it's simply taking a moment to reflect on what intimacy means to you and how you can prioritize it in your life. Whatever it is, remember, you deserve to feel connected, confident, and alive. If you found this video helpful, don't forget to give it a thumbs up and share it with your friends and family. Spreading the word about the importance of senior sexual health can help others feel empowered to embrace this beautiful part of life. And if you haven't already, be sure to subscribe to Vibrant Seniors for more tips, insights, and inspiration on living your best life after 60. Here's to living life to the fullest at every age. Thanks for watching, and remember, the best is yet to come. See you in the next video.